Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Today we'd like to take up nail fungus,
Yes.
which is a common thing for many people,
Yes.
especially in the toenails.
Yes.
Yes.
Great toenails especially.
Yes.
Yes. See, fungus is something opportunistic. Always. Where there is a favorable background, it starts growing. Coincidentally, the nail is the terminal part of arch of our circulatory system in the appendages, in hand as well as in
Yes.
foot. The fingers, toe ends, are the terminal part of the arch of circulation, and therefore there is lack of blood supply. And on the top of that, it's a vulnerable part. You get hit again and again. That's why it's a function of nail is that to protect your toes. It gives grit and protection to the toes. Actually, that's the role nails play. So sometimes you get ingrowing toenails or distorted toenails, and therefore that also causes again lack of blood supply, and then it can't be maintained properly. So nail is something which is like what we call a living part as well as a dead part in between. So that's why it goes on growing, and it doesn't have the acute sensation like our skin. So it is not supplied with the nerves on that. So sometimes if there is any infection or anything, it's not easy to combat it for the body, because the top of the nail is almost like our hair. We can't say it is a dead part, but at the same time it is not rich in nerve supply and blood supply and circulation.
Yes.
And therefore the nails can have fungus growing easily, but not in everyone. Because the structure of the nail itself can be distorted because of some deficiency in elements. Like we have seen, especially where the silicates and phosphates are deficient, the nail gets distorted or malformed or becomes brittle. It's not as healthy as it should be. And then the fungus starts growing. On nails also fungus grows, and sometimes between the webs also the fungus grows between the webs. But the conditions are different. Between the webs, it's that wet moisture which favors the thriving
so
of fungus.
Different effect.
Different genesis.
Yes.
In nails, mainly it is the internal deficiency. So in homeopathy, what we do is we give calcarea floricum or silicea like remedies which help in becoming the nail in becoming healthy. So the brittleness, or sometimes the nail gets cut, split, or they get yellow because of this deficiency, and then the fungus grows. Local or internal antifungal remedies do not help at all, because mainly nail is something which is too much exterior to the body. So it is ridiculous to maintain the whole body levels with antifungal medicines for one corner of the system. And then it will, like they give weekly doses of internal antifungal medicine, and that really takes toll upon our body, because it's not easy to dispose of the antifungal element for one corner. So local management is always better. First of all, you take doses which overcome the deficiency, like silicates, phosphates, and calcarea fluor. At the same time, some local management. And what we suggest is, this Phyllanthus spinosa is a plant. So the juice of that, the extract of that leaf extract, tincture, we can apply locally, and it doesn't allow fungus to grow. Even these marigold flowers, those leaves also are having very good antifungal activity.
The marigold leaves.
Yes, we can apply that. And what we advise is you just dip your feet in water, like body temperature water, for 5-10 minutes, and you clean the area properly, dry it, and then at the most apply coconut oil to it. So this if you do as a local care, and then internal medicines, this fungus can be controlled, but it will not be an overnight affair. It may take few months to overcome, because the infection doesn't come easily, but at the same time to overcome it also will not be easy.
Right.
So patient, doctors both should have ample of patience in it. But it's not a serious ailment.
No. True.
Many times we have seen that psoriasis is an internal thing which is associated with this. Nails become weak, brittle,
Yes.
distorted, and then the fungus grows there. So it can be secondary to that also.
Thank you so much, sir.